As you might imagine or have maybe even experienced, being diagnosed with cancer can take a physical and emotional toll on patients and their loved ones. But some have found creative expression is a good way to help them cope. So here to discuss this is Dr. Andrew Shaw. He's a medical oncologist at Texas Oncology. Good morning to you.
Good morning.
So first and foremost, tell us what exactly you mean when we talk about creative expression.
Well, creative expression can be anything that involves a patient or a person doing something that stretches themselves, that involves using that side of themselves that leads to create a development. So whether it's learning a new musical instrument, joining a dance class or a choir, or writing, or taking an art class.
Oh, that B side of the brain, right? The left side, got to get that side engaged. And why has this been found to really help people?
Well, so every cancer patient has a unique and deeply personal journey. And so, and some of that takes a toll on them, both emotionally and physically. Finding an outlet through creative expression can be very therapeutic and help them through that process. And
in particular, you guys have found that music is really, really good at this.
That's correct. So this has been studied multiple times, and music therapy for patients with cancer has been demonstrated to help with anxiety, reduce fatigue, and even help with pain. And so this all leads to a positive process of promoting health and well-being.
Yeah, and when someone is battling cancer or their loved one is battling cancer, keeping that emotional side of them healthy is really, really important in the fight, right?
Absolutely. We at Texas Oncology, we're very focused on promoting health, treating the entire whole patient, and treating disease is only a portion of that. Emotional well-being, psychological well-being is a prerequisite for overall health. And so helping patients get in touch with that side, expressing it, understanding it, and helping those around them understand it is absolutely in conjunction with our goal of helping the patient be as well as possible.
So if someone is dealing with the diagnosis, they're going through treatment, you know, they think, hey, maybe this is something I could benefit from, how do you suggest they go about finding the right activity for them?
Well, as I said, every patient is different. So what I do is I encourage them to express themselves, and even if they don't consider themselves an artistic person, finding ways to push themselves in ways that help bring them back to balance.
All right, Dr. Shaw, we thank you so much for joining us today with these great tips. If you guys missed any of this, don't worry, we're going to upload this interview onto KVUE.com right after the newscast. We'll be right back.